Great. So those of you watching our recording, hello and welcome to our seminar today on theatres and audiences in 2021. So we don't know what 2021 has in store. We don't know the speed at which restrictions will be lifted. We know that theatres are going to have to plan for a range of possible futures, and we've discussed that in our seminar back in December about how theatres can plan for different scenarios. What we do know is that as theatres, we all have a relationship with our audiences and a need to create and present engaging performances with them, despite the challenges that we're facing. We're not going to dwell too much on the present lockdown situation across the 4 UK nations, and instead look at some of the work that has been able to happen and some of the work that that is planned for when our doors are able to open. We're joined by an incredible group of speakers today, so I won't hog too much time in between and now and I'll just move straight on through to try and get through all of the great content we have for you. I'll move on to introducing first Kate McGrath. Kate is the Director and Chief Executive of Fuel, a leader in independent producing around the UK, with a focus on socially and politically engaged work. Fuel have been involved in productions across the country in the last year, and Kate is going to share some of her learning with us now. Are you there, Kate?
I am, yeah. Hello. Thank you, Tom. It's really amazing to see everyone and to see 5 pages worth of people here. So thank you for asking me, and I hope I can kick us off with something interesting. I'm also really looking forward to hearing from all the other speakers. I've been asked to stick to 5 minutes, is that right, Tom? So I will try and do that. So thank you for the introduction. I am, Director and Chief Executive of Fuel. Fuel is a producing organisation. We've been making new work for 16 and a half years, and we are building free. So I suppose in the context of talking about how we can attract audiences back to theatres, it's probably important to say that we don't have a building, and so we're working in partnership in everything that we do. And my perspective comes from that perspective of being an independent producing organisation, working in collaboration with buildings and with other sorts of organisations, both within and outside the arts. So first of all, I wanted to sort of question the question, not to be pedantic, but I guess just to make the point and make the case that while theatres have been closed, theatre has not, and there has been a huge amount of activity, as everyone knows, from producing and touring organisations, independent artist-led companies, freelancers, and from theatres themselves outside their theatre buildings in different ways. I say that because I think that holds some of the key to the answer to the question that you're asking, which is that I think we need to keep engaging now and not wait until theatres can reopen. And I thought it might be useful to just share a few of the ways that we have tried at Fuel to do that so far, and some of the things that's thrown up for us in case it's useful. So we started the first lockdown by, like everyone else, unproducing and cancelling or postponing or putting on ice a whole kind of year's worth of programme. And the first new offer that we made to try and keep artists and theatre makers engaged and employed, and audiences connecting with us and with each other, was a project called Love Letters at Home, which was an adaptation of a show that we'd made more than a decade ago. And it happened on Zoom with a limited audience capacity. And it was live, it was participatory, it involved the audience authoring some of the work themselves. And thematically, it's about connection, it's about love, and it felt very important to give people the opportunity in that moment of isolation last year to connect with each other. I wanted to mention that one of the ways that we attracted audiences to that project back in April, May, June of 2020 was to frame the performances as a virtual tour. So we have relationships with venues of all scales around the country and internationally, and festivals. And we reached out to them in their moment of crisis and closure and said, would you present a performance of Love Letters at Home for your audience? And in some ways, it feels like quite a strange idea, but it really unlocked something in terms of the audiences that we could reach with the work. We worked with the venues and they were able to offer something to their audiences at a moment when, for many of them, they were too busy dealing with the immediate consequences of closure and furloughing and redundancies to be able to make offers themselves of new productions, new projects. So we had very interesting audiences for that project. I can talk more about it later if it's useful, but a real mixture of audiences who came through the venue. So when we were performing in Mold in Wales, we had an audience who would attend that theatre. And when we were presenting it for an audience in Mexico City, we also had an audience from Mexico City. There were, it was of course possible to access it from anywhere in the world. And so we also had a really interesting mixture of people attending from elsewhere as well. That model has been picked up by other producers since then, but it felt to us like it was a really, really interesting way of reaching beyond our bubble. Like everyone else, we also streamed some archival work, but we tried in every case to make a bit of an event out of it, to celebrate the liveness of the work that we do, to think about how we could give audiences the opportunity to engage with the work, with the artists and with each other around their responses. So in some case that was about offering an online theatre club for audiences to come and talk about the work they'd seen. In some cases it was about a watch party. There are lots of different models out there, but just remembering that liveness is what we do and what makes attending something exciting for people. We also started to reinvent what the theatre space might look like at home for ourselves. So we adapted what had been a live installation project, Charlie Ward, for people's own homes. So people could set up the installation and experience it on their own at home. That involved quite a lot of adaptation of the project, but it was a really interesting way of offering people a different sort of experience when they were trapped in their homes. In the autumn, we started a season called Come What May, which essentially we are still in. And I guess that's the spirit of the work that we're doing at the moment is we will connect with audiences somehow or other, come what may. And that work, I guess examples of what that has meant for us in terms of how we attract audiences has been something like The Kids Are All Right, which was originally an indoor studio touring show, which we pivoted initially to become an outdoor show to be performed in housing estates. And then when the second lockdown came, we had to pivot again at very short notice and film the performance. And we then worked with our partners who we were going to perform it with live to make sure that it could reach the audiences in those communities that we'd intended to reach. And in some cases that meant, for example, where we had planned to offer food alongside the live performance, the partners were able to drop food parcels at each of the residents' houses at a time when we were also ready to stream the film of the performance. So joining up the digital and the live in different ways. We also did a project called Signal Fires, which was our way of trying to do some outdoor socially distanced work. But in Scotland, that wasn't possible. So we found a way to present the work on the phone. And I mention that because digital poverty is a real thing. And we wanted to find a way to reach people in the Highlands and Islands of Scotland with something that they might be able to access even if they didn't have great internet connection. We're currently producing a project that you can experience in your own bath at home. Happy to talk more about that. And I know I need to wrap up. So I guess I just wanted to say some of the things that this has made us think about include data, happy to talk more about that, online platforms and digital skills, income generation for these different kinds of work, access and inclusion and what that means when we're working in these different ways, relevance now and also to our programs post-COVID, internationalism and the climate crisis, and what are the opportunities in how we can think about this differently. I hope that's a good provocation. I've gone over my time. I'm really sorry, Tom.
So many projects to cover in such a tiny amount of time, and but yeah, a real whistle stop of what can be done there, and I think really interesting about kind of the role of the theatre organisations who you've worked with as that connection with their audience and with their community as well, and having not just a sense of being data holders, but being people in a place who can actually interact with people in that place, even in a different way, by delivering the food parcels or things like that. A really interesting part of that. I'll hold off on questions from the audience just now, so if you've got questions you can think about them and stick them in the chat while we'll hear from Caroline Routh. Caroline is the Chief Executive and Executive Director of the Stephen Joseph Theatre in Scarborough. And I understand you've been doing a bit of work around how you can build that audience confidence about being able to return to the theatre. Is that right, Caroline? Did see you on the chat. I did see you arriving.
Yeah, I'm here.
There you are.
Sorry, just remembering to unmute myself. Thanks very much for asking me along today. Yeah, I mean, I completely agree with what Kate's just talked about, and certainly engaging with our audiences is an ongoing process and nothing that stopped while our building's been closed. And just as an aside, we were one of the venues that booked Love Letters, which is a really beautiful show. But what I've been asked to speak about are some of the really practical elements that we found worked for us when we reopened our building to the public back in October and then again in December. Similar to many theatres, our core audience is an older one. In our case, 55% of our audience is aged over 65. With this demographic at high risk from the pandemic and therefore least likely to return, our priorities were to find the ways to encourage them to come into the building in the first place, and then to make them feel safe once they were there, so they would A, return, and B, tell everyone else to come. We wanted to find as many different entrance points as possible to ensure that as many people as possible would feel a real desire to come into our theatre. So we ensured that our live programmes still offered the range of work that our audiences associated with us. And we focused on creating what we hoped our audiences would consider to be must-see work in collaboration with some of our most popular artists and companies. We figured it didn't really matter if people came to SJT in the first instance for something that wasn't theatre, as long as we ensured that once they'd come in, we could make them feel comfortable about being there and want to return. And at that point, maybe try something different. So we offered our bar area, which we weren't able to use at this point, to a local cafe who weren't able to open their premises in any viable way under the social distancing measures. Part of this was absolutely about supporting a company who were hugely supportive of us. But we also wanted to create an opportunity to bring individuals into our building who might not want to come and see a show, but who would want to come and have a coffee and cake with a friend. Or someone for whom coming and sitting in an enclosed dark space was initially a step too far, but sitting in a light and airy cafe felt just fine. Because we had a cinema, we offered a film programme long before we were able to do live performance. It was zero financial risk to us. It appealed to a wider audience than just our theatre audience, and it generated positive word of mouth about our building and the experience from the outset. We did, of course, put in place all the safety measures you would expect: comprehensive signage, hand sanitizer, social distancing, mask wearing, temperature checks. We had a meter and a greeter at the front desk to welcome people and explain exactly what all the new measures were. Our front of house team took on cleaning responsibilities, making themselves very visible in wiping down handrails and such. We moved to e-ticketing as much as possible, but also printed out a list of attendees for every performance, so that anyone who wasn't comfortable with the technology could simply turn up and have their name checked off a list. We also found it really important to communicate a clear and simple refund policy, removing any worry that if you booked but then had to cancel, that you would lose your money. We applied for and got the tourism industry We're Good to Go and the UK Theatre See It Safely kite marks, allowing us to tell our public that we were doing everything in accordance with the most stringent measures and that this had been verified by external bodies. But in all of this, we knew we didn't want our theatre to feel sterile. We wanted to retain the feeling of family that our audience is associated with us. So our signage was all done in company colours and in-house style, as were the masks for our staff, which we commissioned from our freelance wardrobe supervisor. We adapted some of the COVID safety messaging into stay safe, stay kind, stay strong, and turned it into theatre style posters for the outside of the building, using images from our productions. And rather than just block off entrances to certain parts of our theatre with tape or more signage, we blocked them off with big standalone banners with more production images and covered them in welcome back and thank you for your support messages. Some of our core staff got involved in doing front of house duties, such as showing audiences to their seats. This allowed us to enforce our social distancing measures and help people navigate around new systems, but it also allowed us to talk to people and start to gauge how they were feeling about being back in the building. We could then make any adjustments necessary as we went along. We repainted, carpeted, and put new smarter lighting up in our fire exits and started to use these as additional exits for our audiences. This meant that we could introduce a fully one-way system throughout our building, removing the likelihood of people passing each other on staircases. We decided to work to 2 metre social distancing rather than the 1 metre plus that was allowed by that point. At this initial stage, we really wanted to err on the side of caution in terms of making our audiences feel safe. We thought it would be better to get fewer people through the doors who did, however, feel completely relaxed about the environment and would then, we hoped, go and sing our praises to others. Guidelines meant that we couldn't open our bar, but one advantage of 2 metre social distancing and the gaps we had to leave between seating rows meant that we could offer an at-seat refreshment service. Staff went to audience members, delivered orders, took card payments, all without anyone having to move from their seat. It did prove hugely popular. We're looking at whether we can bring that back when we're back to normal, as it were. It wasn't possible in the round, but in our studio space, which is end on, we also guaranteed everyone aisle access. So there was no squeezing past fellow audience members on the way to the toilet. Again, operating and budgeting at 2 metre social distancing made this possible and was a big factor in how safe people felt. Once we'd done everything we could think of to get our building ready, we filmed the new COVID safe experience that would be had by a member of the public and put it on our website and on social media. We also put simple, easy to read information up about the different measures we put in place and talked about them endlessly on social media. We received 100% positive feedback on the measures we put in place. So of course, put all that on social media as well. So that's what we did. Probably much that other theatres did or would have done in our position. The main thing for us was that we tried to make everything we did personal, so that even in these strange times, our audiences could recognise us and trust us. Great.
Thanks, Caroline. I mean, I think there's a few different things in there to unpick, which are what are the things that we come away from this and think, actually, this is a new way of us working that we've discovered through these new restrictions, like that at-seat service and those sorts of things. And I think we'll be talking a bit later on about making sure we don't accidentally build barriers engagement in making these changes, and which I think you've kind of really considered there about just welcoming people into the building in that first instance. The question in the chat is for Kate about audience levels for digital work and whether that's kind of held up to the kind of audience levels that you might have expected for these works kind of in person.
Yeah, just quickly, I was just looking at the figures actually. The biggest audience we had was for a streaming of Barbershop Chronicles at home over a 7-day period as part of the National Theatre at Home programme, and that reached 506,000 people over a 7-day period. In terms of other work, Love Letters had a limited capacity, so it's for around 50 people for each performance. And the first tour of that reached about 700 people. And then we did some more touring in the autumn, but I haven't got as far as finding those figures. But about 50 per performance for that one. And it was pretty sold out for all of them. Dead Club, about 1,200 people watched that. So it depends. I mean, that's a much more niche project than something like Barbershop. So it really does vary. And that's one of the interesting things, I guess.
Great, no, excellent. I mean, I think there's it's almost new art forms of Zoom theatre have emerged that we haven't quite kind of got our head around what it could be and what the opportunities are within that. So I think it's going to be an interesting time to see how kind of that's the kind of the liveness can be captured in a digital format. And yeah, certainly something that people will continue to explore, I'm sure. I see there's some questions in the chat about ventilation, but I'm going to hold on to those ones for later on, whenever I think it might be more relevant to some speakers then. So I'll thank you very much to Caroline and Kate, and we'll move on to now look at examples of two theatres who've decided to do things differently, either as a result of the restrictions or as kind of an anticipation of the fallout from the other side of this pandemic. First up is Tarek Iskander from who's the artistic director of Battersea Arts Centre. Prior to Battersea Arts Centre, he's held senior management positions across theatre and the arts, as well as previously within the NHS. BAC have announced a pay what you decide policy for when they reopen. It's quite a major shift in the way that they've worked traditionally, Tarek. So I'm sure you'd like to talk to everybody about how you came to that decision.
Yeah, hey everyone, so lovely to see so many familiar names and nice to be able to talk to you all. Obviously, as positioned by Tom, here ostensibly to talk about our move to pay what you can universal model for all our work, and we're about to announce a spring season, mostly of digital work, but also live activity where that will be applying. But I guess rather than say too much about that, I also just wanted to offer a bit of a provocation, I suppose, or a question, which was partly part of what was in our thinking as we were making this move through this period. It's important to state that this was something we were talking about pre-pandemic, but the pandemic only accelerated our kind of move and shift to that and helped our business model adapt more quickly. But I guess the challenge of this moment, isn't it, is that all our assumptions get questioned, don't they? And it's a brilliant opportunity, particularly to reflect on our values and what we believe and how that plays out in practice. And I think there's some statements that I think we say very often, or sometimes we do hold as beliefs in performance and in theatre, such as we say that performance or art or theatre is for everyone. And I think that's a very profound thing to say. But I suppose the question is, what does that mean? And I think in traditional thinking, we've often as organizations thought, well, what that means is we have to adapt to people's very specific circumstances and needs. So if people have particular access needs, you really try to adapt and support those to make access as easy as possible for them. If people have financial challenges, then you try to offer cheaper tickets or free tickets to particular groups in order to make accessibility. So it's taking a very bespoke approach to access or to inclusion. That also sits as a really comfortable bedfellow with traditional economic thinking, because if you're trying to maximize your income, you also want to adapt to your customers. So you might say, well, some people can pay £100 for their ticket, so let's charge them £100, and some people can't, so let's charge them as little as possible. So and if you're selling airlines, that's exactly how you do it, isn't it? So you make when demand is at its highest at the last minute, you can ramp up the prices and make as much profit as possible. So this kind of very bespoke approach is really attractive, and I think has been the kind of default approach for most of our organizations. I guess putting the pay what you can move in context, there's been, I think, a very profound bit of learning for us as an organization over years, which is definitely predates me, which was about moving to becoming a relaxed venue where universally all our performances became relaxed. And what's interesting about that is that wasn't taking a particular group's access needs and saying, well, we're going to support that particular group in another way. It was completely reframing the game of how everything operates for everyone in order to enable those people to have an equal experience, or as equal as possible experience as everyone else participating in that art. And that has profound knock-on effects in everyone's experience within that space. So if you make every performance relaxed, you aren't segregating that group in a particular way, how they think about themselves and their role, because audience members for all of us are creative participants, they're active, they're the people we want to help us change the world through the art. You know, they aren't just consumers of the art that we produce. And so it changes that atmosphere and that feeling. So part of the thinking at BAC recently has been, we are talking to various people who do want to engage in that that art and that work. For some of those people, finances can be a barrier. It's obviously naive to think that finance is the only barrier, or even often the major barrier. There's all sorts of other things that come into play. But for some people, it matters. Now, one approach is to go, well, let's keep targeting those people, give them free tickets at work. But I think it's, and many other venues have already done this, or other organizers have done this previously. None of this is new. But there's a kind of powerful idea in saying, if we believe theatre's for everyone, if we understand that performance is a communal activity, it's not like selling an airline, it's not like consuming something individually, it's a communal activity. we have a responsibility to create a democratic space where everyone is treated equally, where everyone participates in equal terms. And that has profound implications for how people experience the art and activity that we do. So, and it's also actually easier to implement. So it's easier to say to everyone, everyone can pay what you want or what you can or what you're able to. And we will treat everyone the same. And that has been part of our thinking. And obviously at BAC, that may be easier for us than other organizations. Ticket prices have historically been very low anyway. Ticket income is only 20% of our income. So, you know, again, these are all things we were thinking about previously. But I guess the challenge and the offer, I suppose, is people love the NHS partly because it's universal, partly because it treats everyone based on what they need and who they are, not on their kind of status within society or their ability to buy a ticket or their ability to access a particular mode of performance the way we design it. And I think for us, again, this is in the context of looking at the physical access of a building, looking at the relaxed performances, looking at accessibility in other different ways, inclusion of what we program, how we program it. None of this can be taken in isolation. But I think there's now maybe at this moment of crisis, a dream of universalism for performance that we're all maybe dreaming a little bit more and a little bit more proactively than we have before. And for us, this is one small step in that direction.
Great, thank you very much. Yeah, I think mirroring what's being said about how do we make this a welcoming space and how do we make sure we're not excluding people in what we do. The talk of the welcoming people in, the talk of telephone instead of internet, and here not putting those economic barriers in the way of people engaging. Really kind of keep similar stories coming through here. An interesting thing now from, so Henny Finch is the executive director of the Donmar warehouse, and they took a very innovative approach to the restrictions in the first lockdown, and were able to stage work then. Are you here, Henny?
Hi, yes, I am. Can you hear me? Thanks very much for having me. This is the second time that I've spoken at one of these events just after Tarek, and he's a very hard act to follow because you're always so inspiring. So I'm going to try, but I'm sure I won't be quite as inspiring as you. Actually, I've got a presentation because I thought people were probably quite bored of looking at the backgrounds of people's rooms, and you know, my bookcases are no more interesting than anyone else's, and also there's a high risk of small child entering the room at any given point during the time that I'm speaking. So I'm just going to share my screen, hopefully that'll work, and I can show you some pictures of what I'm talking about. I can work out how to do this. Hopefully that is working. So I want to talk about blindness, which is a piece of work which the Donmar did in late July and August last year, which made us sort of the first theatre in London to reopen to live audience. One of the reasons we were able to programme it is because it actually takes the form of a socially distanced sound installation. So it was permissible in licensing terms as a piece of exhibition as opposed to performance. And then the rules changed actually, and it became possible to do performances at that time as well. And it's an adaptation of a Jose Saramago novel, which Simon Stephen adapted for us, Simon Stevens, and it was directed by Walter Meyer-Johann. And the show was delivered through binaural sound. So Juliet Stevenson recorded the narrative, and the audience came and experienced listening to her through headphones in the space. And you can see there, that's how it looked like in the theatre. And Donmar is actually just currently in this moment in the midst of a capital refurbishment project. So it was quite good timing in that the seats were all out. You can see that the audience is sitting on what's normally the stage, and you can see most of the lights are out, the grid's out. It's quite a fantastic view, really. So audiences consumed this show through listening through headphones, using the binaural sound technology, and they're sitting, as you can see, in kind of socially distanced groups spread throughout the theatre. So every group is 2 meters apart from every other group. So one of the few of the opportunities for us in doing this was we wanted to establish audience confidence in our COVID health and safety protocols. Of course, it's very important to kind of keep the brand in a place of trust for people. We clearly, like everybody, you know, spiritually and financially and practically, and in terms of our philanthropic base, had a need to welcome audiences into the space and be continuing to make audience-facing work. But we also saw this as a chance to welcome perhaps a new audience to the Donmar, which was very exciting. We also, this is building a bit on what Tarek is saying actually about, you know, taking one small step at a time in terms of welcoming more groups of people, but we also wanted to embed our access strategy and our work more closely, and this felt like a really interesting opportunity to do that, and I'll speak about that in a minute. And we wanted to build the audience beyond the Donmar's walls through offering a digital version of the piece, but also because we didn't know at the time when we made this crisis is continuing for a heck of a long time. This is a piece of work which we can then export, and it really helps that it doesn't have any live performers in it, and in fact doesn't require any of the creative team to travel with it. It means that it is on a global trajectory to be opening in various different territories now, just as soon as we're able, which is sort of really new for Donmar, really thrilling. And as I said before, we're just in the process of a big capital project, and we wanted to be able to say farewell to the space before we rip the walls out, which is currently what's going on. It's a building site right now. And of course, as everybody will have said, I'm sure, during today, one of our big motivations was being able to employ some freelancers and being able to employ our front of house staff for even just a short period in the summer, which clearly was sort of, you know, existentially vital. So it went quite well. The New York Times came, they happened to have someone in London, you know, and really liked it, and it sold very well. We ended up extending the run. We were doing 4, I think, shows per day, because the capacity was only 50 per performance. So in order to keep the numbers up, we were running it sort of repeatedly. And you can see that the experience included a sort of light display as well as the sound. So it felt like quite an immersive thing, and not just something which one could have consumed at home. So I said I was going to talk a bit about accessibility. It was really important to us that we understood some of the tensions around the portrayal of blindness in the original novel, which is quite controversial in the visually impaired community, because of the perception that in Jose Saramago he's equating blindness with a pandemic, a disease of blindness sweeps the world. So we wanted to be really careful in the way that we portrayed that, and worked with an academic who is visually impaired to make sure that we presented the subject matter in a way that was constructive and positive and inclusive. We also produced a podcast with Hannah Thompson, which we sent around to the audience ahead of their visits to the show, so that those themes were framed appropriately. And we had every performance audio described, and we had, for the very first time, a version that could be completely consumed at home. And that was very interesting. We managed to attract lots of new bookers for that. And we also sent an audio introduction around all our pre-show comms. And it's been really great. Now the show is touring. I say touring sort of in inverted commas because no one's going with it. It's a sound file. But that accessibility has been really embedded in our touring package. And in fact, in some territories, we will be changing the way that those theatres interact with their patrons, because we're able to send a package out with the show, which is very comprehensive. As you can see, you know, it was just, it moves me even now, just looking at pictures of our theatre. Right? Just so sad that we can't be in it. But anyway, we'll be back soon, let's hope. In terms of attracting new audiences, we got around 44% of bookers were new to file, which I thought was really great. It's quite high for the Donmar. We had a really engaged and kind of loyal audience, and it was nice to feel that to understand that people responded to our recommendation. They were prepared to come and see something which was quite out of the ordinary, really. It was a younger audience. I think that's not surprising. I think older audiences weren't really travelling in the summer. We had 5% of audiences had a disability, according to a survey, which is higher than usual for us. And of course, unsurprisingly, the majority of them lived in London and the South East. Nobody was coming into London if they weren't here already. And as you can see, this is actually not the Donmar, this is Theatre Carry in Amsterdam, where the show briefly opened at the end of last year and has closed again, sadly, but maybe it'll open up again. This is an enormous proscenium arch theatre, as you can see, and we've got the iron out so you can see right into the auditorium. It's beautiful. It's also going to Toronto, it's going to Hong Kong, it's going all around Australia. It's about to open every week. It's about to open in New York just as soon as they're able. So I'm really hoping that it'll have more kind of legs beyond the Donmar, and hopefully we'll start to pay ourselves back for the money which we invested in it. This is just a nice little quote from a survey respondent showing great enthusiasm. We were very, very pleased with the way that audiences responded to it. That's it from me. Just to conclude, audiences were definitely keen to attend. The visibility of the health and safety protocols were very, very important. A lot of that got reported in the press. It became a sort of mark of trust whether they'd come back to the theatre. And the opportunity that this project gave us to work on our access strategy was really great. And I think that's probably led to long-lasting change within the Donmar. So would we do it again? Absolutely. It was a great experience. It was very nice to see audiences for that brief period. Let's hope it's not too long.
It was very nice to be able to go and see it, and it was my first step into a COVID secure venue, and certainly a very innovative way of interpreting those those restrictions and going, actually, what can we make that makes it work? Obviously a challenge with them ever shifting, as we see with the touring production having to close, but yeah, no, a really innovative way of creating work in a safe way in that time. There's a question for Tarek in the chat about how can you make pay what you decide work even with your smaller spaces, and do you assume and have you assumed social distancing in your kind of modelling of how that will work initially?
I mean, yeah, we have assumed social distancing into autumn currently, and kind of assuming maybe post sort of September, October, maybe a higher capacity, but kind of in a graded way rather than a sort of big bang, sudden change approach. I agree, the economics of all this is slightly complicated. And as I was implying earlier, I don't want to pretend that it's the same answer, the same solution for every organization, because all organizations are so different. As I said, BAC generates more than 40% of its income through enterprise activity. So generating ticket income in our smaller spaces kind of is neither here nor there. We can afford to take a risk for us around that. I guess the thing is, it's about asking the right questions, isn't it? And we're all going to come up with very different answers in our own context to those questions. But the big thing for us was allowing ourselves to maybe just take a plunge, maybe take a risk. We genuinely don't know how much income we will generate, if any, through moving to this scheme. But there's a kind of point where you have to be uncompromising and just go for something. And if this pandemic isn't the moment to do that, I don't know when it is.
Yeah, that's great. Thank you. So I thank you very much to Henny and Tarek. We shall move on now to looking at a key theme that's coming out of these discussions is about the confidence of the audiences, and that's kind of key to a recovery. Our next two speakers have been looking at ways to track that confidence and to reassure people that it's safe to return. So first up is Flo Carr. Flo's an experienced marketeer who was previously the head of comms and marketing at the Arcola Theatre, but during April of last year, she joined Indigo. Thereafter, the Interval survey was one of the first glimpses that we as a sector had into audience confidence. And Flo, do you want to tell us more about what you're up to now in terms of tracking the confidence?
Yeah, of course. Hi, everyone. Very nice to be here. And yeah, thanks so much for the very inspiring presentations so far. I am going to share my screen. Brilliant. So yes, hopefully you should now be seeing my screen there. Cool. So I'm actually, yes, so I'm going to be talking a little bit about the kind of research we've done generally, but my focus for this 5-minute session is on welcoming back family audiences. So that is one of the kind of deeper dives we've done into the data. And the way I've structured this just for this very quick presentation is to look at our 3 top tips about family audiences. So just what I'm gonna, just a quick aside on where this data comes from. So since April, as Tom said, we've been running a series of free national audience surveys for theatres and other cultural venues to use. And I can see that I recognise lots of you on the webinar and that you've been involved, so that's great. We started with After the Interval in April, and we're now running our Culture Restart Toolkit with partners Baker Richards and One Further. The way these work is we provide a survey link and the venues send it out to a portion of their database. You can see your individual responses in real time, and all the responses flow back into our software. And what's brilliant about that is that it's enabled us to build up this kind of massive national picture of audiences and confidence levels. We've so far gathered about 275,000 responses so far across all the research. And what we can then do is do these kind of deeper dives into particular audience segments. So we've been looking for this one at family and children's work. So I'm going to get going on my top 3 tips. So the first one is don't forget about them. So what we've seen very clearly is that family audiences want to return, even more so than kind of general audiences. Our latest findings show that 63% of them would be happy to return as soon as venues can reopen, just so long as they're happy with the kind of social distancing and safety measures in place. And that was compared to 55% of other audiences, so about 8% higher. And they're also a lot less likely to say that they're going to wait for a vaccine before returning. However, one of the themes that we saw coming out quite clearly in the comments was that family audiences were very concerned that they were going to be the last to be considered by theatres when they were planning their programmes for returning. And I think this is a kind of particular challenge this year because of Christmas. Almost all venues obviously had to cancel their Christmas shows this year. Well done to those who did manage to go ahead with it. But that kind of key moment of family audience engagement, which is often their only interaction with a venue each year, obviously didn't happen. So the way that we're thinking about this is really through communication. So regular and clear communication targeted to your family audiences is going to be the best way to kind of reassure them that you're thinking about them and planning for their return. So when it does get to their returns, to their return, you need to consider their kind of particular and unique needs. And the few themes that we've seen coming out in this are price sensitivity. So family audiences we've seen are one of the most likely groups to have had their income reduced due to COVID. And we saw that kind of clear and flexible policies for exchanges and refunds are really important to them as well. So those kind of things to consider when thinking about your pricing strategies for family shows, and the kind of ways that you can encourage them to feel confident returning. And then what about when they do actually return in person? So it's obviously very likely that some health monitoring or social distancing measures are going to still be in place despite the vaccine when venues are able to reopen. And what we've seen is that family audiences are quite nervous about the sort of more invasive health checks, or such as kind of rapid testing or temperature checks. There was one quote from an audience member saying, "I don't want my family to go through a COVID test unless they need to. It's not a pleasant test, especially for children." And there were concerns also from parents about whether they were going to be able to enforce the social distancing that venues required, or whether their kids were going to be kind of running riot and upsetting other audience members. Generally, the kind of return to a venue seemed to be a level of stress that for some family audiences, it was kind of just too much. So our advice here would be really to think about the return experience from their perspective. So create guidance for your audiences and your staff specifically for family audiences, making it clear which of your safety measures are going to apply to children and what there will be in place at the venues to support their safe and comfortable return. So really everything that Caroline was saying they did at the Stephen Joseph, but with a family slant as well. And then finally, while venues remain closed for in-person and indoor experiences, be adventurous. What we saw was that family audiences are one of the segments who are most up for trying new things to keep the kids entertained at the moment. And two kind of particular areas to consider: online. So we saw that family audiences, although they're less likely to have engaged online so far, they're just as likely to say they're interested in the future. and there are some really exciting opportunities with them for kind of particular formats. So we saw that families were really interested in creative activities online and interactive performances and events. They're also much more likely to pay for these. And one more thing to consider, perhaps when the weather starts to improve, as I look out on a very drizzly Manchester day, is outdoor experiences. So again, family audiences are less likely to have engaged in these so far, but they're more interested than any other segment in trying a kind of full wide range of different kinds of outdoor events. They weren't concerned about the weather, they weren't concerned about having to stand for long periods of time. Basically, they're up for anything that could get the kids out of the house in a safe and interesting way. So hopefully those two are kind of some inspiring things to think about while your venues remain closed for those kind of in-person experiences. And one final thought, why not ask them yourselves? So yeah, it would be great to have you involved in our audience tracker, which is this kind of ongoing research that we're doing to track these kind of things. It's not just for family audiences, and is a great way to kind of build up that kind of data to help you plan for reopening. And do, yeah, have a look on our website, and also on the Baker Richards website. There's a lot more of kind of blog pieces on the data that we've been doing. So yeah, thanks very much, and very happy to answer any questions that you have.
Thank you very much, Flo. I think we'll make sure we share those links with the recording when they go out as well, and for those organisations that want to get involved in tracking what their audiences feel about returning. And I think there's some really important questions in there about what are those features that they expect to see in order to make them feel at ease, which I think would be really useful for them. We will, someone was asking what kind of sample size is your information drawn from?
Yeah, so for after the interval and Act 2 surveys, I think it was around 2,500 people had said that family or children's work was their primary art form. And for Culture Restart, it's about 500 people. So generally it tends to be between sort of 3 and 5% of the total respondents. So a kind of good enough big sample size that we can compare it to the wider data set as well.
Great, excellent. Okay, so moving on, our next speaker is Phillip Brown, who is the head of risk and safety at SOLT UK Theatre, which, you know, what a year to be that. SOLT UK Theatre have been a key partner in advocating for the safe reopening in theatres, and have created the See It Safely Toolkit, which Phil will now introduce.
Hi everyone, I'll just give you kind of an oversight of the system, what it's all about, and kind of how well it's been taken up by the industry. Excuse me. So we launched it back in September, and I guess the whole point of the campaign is to encourage our audiences to come back to venues with confidence that health and safety, and in particular COVID safety, is being considered by each venue. I guess it also gives staff coming back confidence that obviously the venue is taking things seriously. And one of the good things quite early on was it was very much supported by DCMS to roll that out to as many theatres and live event spaces as possible, to kind of try to create this mark that was visible across the whole of the live entertainment world. We kind of offer it to SOLT UK Theatre members and also non-members, and I suppose the good thing in the current climate is it's totally free, so you don't have to pay anything to kind of sign up to it. We're also working with other partners around the country, including the Federation of Scottish Theatres. They are kind of doing their own monitoring and management up there, but kind of in conjunction with us. My kind of role is to kind of oversee the risk management aspects of it. My marketing colleagues, they kind of do the marketing aspects. So I kind of look at the risk management side of it to make sure that when people apply, they're answering kind of yes to the questions that we need them to kind of respond to. So the kind of things that we're looking for, kind of that venues have got a COVID risk assessment, that they're following the current DCMS guidance, or whichever kind of nation they're working in, whichever guidance is relevant to them. And obviously looking at things like social distance and training. Part of my role, I'm kind of classed for the members as a member resource. You can make of that whatever you want. And kind of part of that process for me is to kind of give ongoing support to members. So if obviously someone isn't sure how to do a risk assessment, then obviously I've got the tools and the kind of support network to kind of help them create that process. Initially, we opened the process up to venue operators, so kind of more of our members who are kind of fixed in a venue. But over the last few months, we've created a touring and a producer version. So it's similar, but obviously fits more into the model of someone who's kind of touring around the country. So far, I think the last count we had about 310, 315 organisations around the country who'd signed up to it. And I suppose the nice thing was it's not just the professional world, it's the non-professional world who've also signed up to that, which is really encouraging. And actually from a personal perspective, I've probably spent more time actually talking to some of the non-professionals rather than the professional world and kind of giving them the support who perhaps haven't got access to health and safety people or kind of full-time technical management, so sometimes they might struggle a little bit with some of those aspects. So that's been really encouraging. So once the application process is kind of been completed and I've kind of given it the once over, I will add one thing. There is also the threat that I might turn up in your venue just to double check that these things have happened. Haven't done that yet, obviously, with the current lockdown, but that's a threat that is always hanging over someone's shoulders. But I'm very friendly and I just do like a cup of tea if I do turn up. What you get once the process is completed, you get a certificate which you can display again to show audiences that you're part of the scheme. You get an animated video which goes through the key kind of requirements that we need to think about. So again, kind of social distancing, face coverings. You get signage, again, social distancing, face coverings and other things that you can display around the venue. And you also get a web copy of this to put on your own social media websites to kind of put that onto your own site to kind of show your audiences. And I think the nice thing is that obviously when we did open pre-Christmas, it was great to see a lot of the See It Safely logos on a lot of the productions and a lot of the venues. And obviously it was very sad that we had to close down. Working alongside the See It Safely campaign, we've also got a hashtag which is called Back on Stage, which again, our marketing team are encouraging venues and audience members to kind of hashtag kind of that they've seen a show and try to kind of build that audience confidence. It worked a little bit pre-Christmas, but obviously we all know what happened kind of, and that's slowed down. I will also say probably the application process has slowed down a little since the lockdown. I think we've had a few trickling in, but I imagine once we know what happens in the next few weeks, that will probably start to ramp up again. But I think, Tom, that's kind of it in a bit of a nutshell, really, if that's okay, if that's enough.
Yeah, that's great. That's a useful kind of badging system that people can show that they're actually applying the guidance as it's intended. I think there's a few questions that are in the chat which I'll try and kind of give a kind of summary answer, which and then see if there's anything for you to add, because I don't want to put you on the spot because they're not directly about See It Safely. So a few questions have come in around what theatres are doing around ventilation and the research into that in order to be able to reopen safely. I'm certainly aware that SOLT UK Theatre have been involved in and they're starting to do testing on these sorts of things. And it's very much a live issue for how we look at how theatres might be able to reopen with improved ventilation. Certainly, I know there's an immersive theatre space that's got UV filtration units, which they're testing as well. Which is kind of lots of things are being tested at the moment, is my understanding, but we don't have the kind of the data yet or the decisions on what the safe routes are going to be in terms of ventilation and standards.
I think obviously we had a lot of pilots planned kind of for December and January, but obviously we needed a venue to be open with audiences in the venues to kind of do that research. So it's probably taken a little bit of a backseat, and what I should have said is I kind of work very closely with DCMS and some working parties in regards to how we move from where we are now to kind of full reopening for the future. And some of the working parties have been reconfigured to actually start to think about different things that perhaps have come to light over the last few weeks. Things like perhaps mass testing and rapid testing might have taken a bit more of a probably advanced up the priority list rather than ventilation. So I think ventilation is still in the background. I think Public Health England have got some concerns, and I know that some of their scientists are looking at ventilation in general, but with the venues being closed, those pilots haven't happened. But I think we're looking to see if we can still do some with closed venues to try to replicate what it might be like without an audience in there, kind of to see what we can move forward. But at the moment, other things have kind of moved ahead of that, I think it's probably fair to say.
So the mass testing is a point there about saying there's a potential for there being this kind of passporting system of vaccinated or tested people being able to do it. And again, I suppose we're in the early stages of that being investigated. Is the situation, is it, Phil?
Yeah, we've had approached by DCMS to look at doing some pilots on the mass and rapid testing. So we've asked some members to kind of come back to us with their intentions about reopening. So, but it's also not just for audience members; it would be for people who are starting to look at rehearsals and actually getting back into venues. So there is some work going on in the background, and hopefully we'll kind of have some announcements soon on that. So I think there's kind of a lot happening, but I think with the current lockdown, I think government are just waiting to get through that, and then I think once that happens, they'll be kind of ramping up a lot of the actions for our industry and other industries to get back open as quickly as possible.
That's great. Thank you very much, Phil.
Okay.
I'll move on to our final speaker for today. Our final speaker is Andrew Miller, who's the government's first disability champion for arts and culture. And as restrictions change quickly, and we quickly have to develop solutions to work, it could be very easy to overlook the harm and barriers that we could be creating, and we could be taking this opportunity to create a more inclusive approach to our work. So I think he's sharing the screen there. Tash, great, excellent. Okay, so I'll hand over to Andrew, who is going to introduce his we shall not be removed 7 principles.
Thank you very much, Tom. I've also got some slides to entertain you with. I'm here to tell you, as Tom said, about we shall not be removed. I'm also going to talk about ableism and the 7 inclusive principles for arts and cultural organisations that were launched back in September that should assist you to reopen more accessibly. I'm a middle-aged white wheelchair user with glasses sitting in my studio in front of a bright orange blind. Grey Eye theatre director Jenny Seeley and I started We Shall Not Be Removed back in May. And as we were both concerned about the invisibility of disabled people in the national COVID narrative, together with the huge threats posed by the crisis to all the inclusive progress made by creative disabled people in the cultural industries. Disabled people have felt badly overlooked throughout the pandemic, despite accounting for 2/3 of all coronavirus deaths in the UK. The risks to us have been frighteningly real, with the loss of many disabled artists and many disabled creative leaders. So we brought together an alliance of both disabled-led and inclusive organisations, as well as individuals, to work together through this emergency. The aims of the campaign are to raise the profile of creative, deaf, disabled and neurodiverse people during the pandemic, and to advocate for a more inclusive cultural recovery. Our alliance now has over 700 members from across all art forms, all impairment groups, and from across all 4 UK nations. And this represents the biggest disability arts movement in the UK since the 1980s. Activism to highlight inequalities in our sector has brought to the fore the voices of those with the most to lose as the industry unravels: creative freelancers, Black and Asian workers, and disabled artists and audiences. But what do we actually know about disabled audiences? It was a significant moment when Arts Council England announced in February last year that disabled people made up 12% of national portfolio organisation audiences during 2018-19. This statistic established for the first time that disabled people represented a substantial audience segment, according to the Purple Pound, real commercial value to the arts industry. While still some way off representing the 21% of UK population who identify as disabled, it also provides an encouraging sign that large numbers of disabled people actively and regularly engage with culture. Since the pandemic took hold, all we have to go on is Indigo Consulting's After the Interval Act 2 survey of audience from July last year that Flo mentioned. This is the only large-scale analysis so far to give any insight into what disabled audiences are thinking. The key finding was a massive loss of confidence in disabled audiences for attending mass gatherings. 77% of disabled audiences considered themselves to be vulnerable to coronavirus, whilst only 28% of non-disabled audiences did, which conveys vastly different priorities and concerns between disabled and non-disabled audiences, and clearly with good reason, given the death toll. A full quarter of disabled audiences said they would not consider returning to venues at all until a vaccine was in place. So when theatres can reopen, they face a massive task rebuilding the confidence of that 12% of their audience who consider themselves disabled. At the same time as that survey was taking place last summer, sector-leading bodies and individual cultural organisations were busy interpreting government reopening guidance, giving rise to unintended discriminatory practice being applied to disabled artists, employees, and audiences, which is why we created the 7 inclusive principles to assist the sector navigate its way through. But just as the response of our sector to Black Lives Matter has been to open up a discussion around racism, disabled people want to see a response to the pandemic open up a dialogue around ableism. The art sector that closed down in March didn't work for many creative disabled people due to the industry's endemic ableism. Outside of the disability community, ableism is still a largely unfamiliar term, but assuredly as racism, sexism, ageism, and homophobia, ableism wrecks opportunities for disabled people. Put simply, ableism is the behavior which unintentionally excludes or actively discriminates against disabled people. It applies to a range of situations from limited physical access to a limited understanding of the support deaf, neurodiverse, and disabled people need to succeed. Ableism also acts as a conditioning agent, setting boundaries that limit disabled people's expectations. And the pandemic has made matters worse. New rules now apply, and so too do new barriers. And that's where the 7 inclusive principles come in. The principles have been developed by a partnership of campaigning cultural organisations comprising us at We Shall Not Be Removed, Ramps on the Moon, Attitude is Everything, Para Orchestra, and What Next. The principles are specifically aimed at the non-disabled mainstream arts and entertainment sector to support disability inclusion through these difficult times. The focus is to ensure disabled people are not discriminated against as creative work begins again and as venues reopen. The 7 principles offer practical guidance to support disabled artists, audiences, visitors, participants, and employees. The principles highlight the importance of meeting the legal obligations of the Equality Act. All organisational activities must comply with the requirements of the Equality Act and make reasonable adjustments to operating practice that ensure disabled people are not unlawfully discriminated against. This is a simple and non-negotiable principle which should guide everything you do in this area. You have a role in combating ableism in the sector by encouraging the use of the social model of disability. The social model recognises that it's society's barriers, not an individual's impairment, that causes discrimination and excludes disabled people. You therefore have a duty to understand what ableism is, identify and eliminate it from your working methods. Adopting an anti-ableist approach will have significant impact on all your interactions with disabled artists, audiences, and employees. It's vital organisations consult directly with disabled people when creating COVID-secure measures that directly impact disabled people. This is about co-production, authenticity, and the rallying cry of the disability movement, nothing about us without us. It still holds true, as disabled people are the leading experts on disability, but even now our voices are all too often ignored. Organisations need to provide clear, accurate, and comprehensive information about their COVID measures, made available in a variety of accessible formats to enable disabled audiences and participants assess their own levels of risk. It's also important organisations are prepared to flexibly adapt to specific inquiries or requests from disabled individuals. The customer journey for disabled audiences should be thoroughly mapped, ensuring it is equality impact assessed, does not pose any onerous or unreasonable requirements of disabled audiences. For example, queuing, accessible seating not being made available, hygienic facilities and free companion tickets. All of these should be regarded as essential in maintaining access. The sixth principle is specifically for producing organisations to encourage the engagement of disabled artists in the creation of all new work. The UK is a global leader in inclusive arts, and we must ensure that's maintained and protected through the pandemic and beyond. We Shall Not Be Removed is currently undertaking a survey of its membership to gain an understanding of the financial and career impact that the pandemic is having on disabled artists, and we'll publish that in due course. And finally, celebrating disability in the workforce, particularly when difficult decisions around redundancy are being made. This has never been more important, as the signals are that diverse employees are at the highest risk of redundancy. Organisations should ensure they celebrate diversity, embed anti-ableist principles to support and protect disabled employees. This will serve you well, as audiences and funders' expectations around diversity of the organisations they support is only going to increase, not diminish. The 7 principles are applicable across all art forms and across all 4 UK nations, and come with the endorsement from a wide range of leading organisations, including the 4 UK Arts Councils, the British Council, British Film Institute, Museums Association, Musicians Union, UK Theatre, and the Theatre Trust. The 7 Principles document can be found on the We Shall Not Be Removed website in all accessible formats. It contains links to a wide range of free resources to support people at every level in the art sector really get to grips with best practice. And it's important that everyone from management to programmers, front of house to box office, understand their implications. The 7 Principles also form part of the UK Theatres See It Safely campaign that Phil just told us about, and they've also been launched in Australia. Alongside the work of We Shall Not Be Removed and the 7 Principles, it's also worth checking out the Audience Access Alliance, which has been also formed to support the wider live events industry with Building Back for All, demanding an inclusive recovery for disabled audiences. This coalition is made up of a number of leading audience-focused organisations from across industry sectors and 2 government disability champions. So whilst things are looking grim right now, I'd like to encourage you to commit to creating a more inclusive industry on the other side of this catastrophe. Every ticket sale will count when the recovery is underway. It will never have been more vital for our theatres to remove all barriers. And indeed, given the scale of the disabled audience and the strength of our purchasing power, it's both a moral and commercial necessity. Of course, inducements will be needed, and I very much hope the 4 UK Arts Councils will assist you all by introducing a National Arts Access Card Scheme and a Disability Cultural Charter, both of which I've campaigned for during my time as government champion. Because on the other side, we will all have been through too much to allow the old discriminatory barriers re-emerge to prevent inclusion. Hope that was all useful, and thank you very much.
Thank you very much, Andrew. I think it rings true that people everywhere have had to start doing these risk assessments for them to assess their personal risk before they attend the theatre, and it's uncovered that maybe we've not made that route easy for people who've had to do that pre-pandemic, and it's certainly putting in these measures of considering that the inclusive principles could help having a welcoming experience for all audiences. So I think it absolutely is a vital thing to embrace this. I was wondering whether you had come across kind of great examples of these inclusive principles being applied that people might want to look towards to see.
It's a very, very good question, Tom, and I think it's a little bit too early to say. They were launched in September, and you know, we would be very, very interested to hear from organisations who are applying them and are finding them useful. I know Battersea Art Centre has been looking at it, and of course, the work that Tarek's been doing there in terms of making it a relaxed venue, you know, gives back a little bit of an advantage there. But I'd certainly be very interested to hear how organisations, or even the challenges that the principles offer organisations, because maybe that's the next stage of work of actually coming together and putting together some case studies.
Great, thank you very much. I don't see any other questions in the chat, so I'll just move on to wrapping up now. So thank you everybody for attending. We have another session in 2 weeks' time, where today we've really considered theatres and audiences in the sense of performed work and the arts. In the next session in 2 weeks' time, we're going to look more at the civic role of theatres and how they've stepped up to work alongside community organisations during the pandemic, both in a kind of in a co-creation sense, and also just reimagining what they could use their building for during this time when they can't use it to put theatre on. So very warmly invite everybody along to that one. And then in a month's time, we will look more at what it means to be reimagining the organisation and the impacts that the lockdown has had on considering the mental health of the people we work with, and new ways of engaging with digital, and how we manage to do that in a way that changes the way our organisations work. All of our previous seminars are available online, and as this one will be in a few days' time, along with links to all of the resources that have been mentioned in the various talks. So thank you all very much for attending. This seminar series was supported in part by the Garfield Weston Foundation, I'm required to say. I got that very important point. And yeah, I look forward to welcoming you all again to future Theatres Trust events. Thank you very much.